Knock knock, provide privacy, hand hygiene. Hi, my name is Kanisha. I'll be your student nurse today. Can I start out by getting your name and date of birth? Are you in any pain today? Do you have any allergies? All right. Well, I'm here to insert an NG tube before we get started. So the NG tube is, I'm going to be inserting it from the tip of your nose. It's going from your nose to your stomach. But before we get started, I'm going to ask you a couple questions. Have you had any previous surgeries on your nose? Is there a side that you breathe out of better? Okay. I'm going to have you blow your nose. I'm going to give you some tissue. And have you blow your nose. All right. And then I'm going to also do a bowel assessment, okay? So what I'm going to do is I'm going to ask you a couple questions. When do you have a regular bowel movement, like schedule? Is there a time that you go often? When was your last bowel movement and how did it look? Okay, so first I'm going to look at your stomach. Looking for any distensions. Everything looks fine. Then I'm going to listen. I'm listening in each quad for 5 to 30 gurgles for at least a full minute. I'm going to start with the the left lower quad, and I'm going to work my way around. One full minute. One full minute. One full minute. One full minute. Okay, everything looks good. I'm gonna palpate it. Okay. You're looking good. Okay, so I'm gonna get me some gloves. And we're gonna get your tube inserted, okay? Let's put a towel down.
And are you allergic to any latex?
Okay. So I have my tube. I'm gonna get my tape. Okay. I'm also gonna give you a glass of water to help you swallow better. And if you have any trouble doing the procedure, you can always raise your hand and I will stop, okay? So,
and I'll go all the way down.
We're going to take the tube and we're going to measure it first, okay? Like I said, we're going from the tip of your nose, from your nose down to your stomach. So I'm going to measure by tip of your nose to the bottom of the earlobe, from your earlobe down to your xiphoid process. I will hold this to know where I will put my tape to know how far it would be inserted. Just want to pull some tape off. I'm going to mark my tube in.
If I don't do x-ray, I will pull back.
Then I'm going to take another piece of tape to secure my tube once I put it in.
So I'll clamp it. Pull back my tube.
Okay.
Clamp it. Put my pH.
So now we're going to insert the tube. I'm going to hold your head back and insert it downward in a downward motion so I won't go up and insert into the brain. And once I start to engage the tube, I'm going to have you tilt your head forward and drink some water. Drink your water so you can swallow better, okay? So I'm going to lubricate my tubing, lubricating the tip of it. All right, here we go. I'm going to lean your head back. And we're gonna insert it, okay? All right, tipped up. 1, 2, 3, swallow, okay? I'm gonna hold this so it won't come back out. I'm gonna take my tube in my tape and secure my tube. Okay.
Okay. So I'm hooking
I have got the tubes into place. I will check that using X-ray or pulling out gastric content. So I will get my syringe, clamp my tube, clamp it before so air won't get into my patient, open it up, pull back gastric content,
because it will everything that
clamp it back, check the pH. Wherever I take out, I'll put back in. And clamp my tubing. Okay? Before I open it up, I would have clamped it so air won't get into it. So I can check it with X-ray, either gastric content. But if I was thinking I was in the wrong spot, I would see nausea, vomiting, or my patient would be turning blue or something. So I will quickly remove the tube. Okay. So next we're gonna hook you up to suctioning. So I'm gonna hook him up to suctioning. Before I hook him up to suction, I will check X-ray. I place him with X-ray and gastric content removal. So I have my suction. I'll plug it in. Clamp my tube before I open it. Plug it into suction. Okay. Like I said before I turn my suction on, I will check placement with X-ray and gastric content. I will come over here and put it on intermediate. I will turn on intermediate. I will set it in the green, 80 to 0. If my tubing becomes clogged, I can turn it up a little bit more above 0 to unclog it, or put in warm water to fill the tubing. Okay, so the tubing is on. He's been hooked up to tubing. We verified the place before we hooked him up. All right, next we're going to do a bolus feeding. So I will unplug the suction for at least 30 minutes. Clamp my tubing, unplug the suction. Okay, and we're gonna get ready for our bolus feeding. So we're gonna take the top off the syringe. So I unplugged them from suctioning for at least 30 minutes before I got started on my feed. I'm gonna clamp my syringe in my tubing so I can open my system up. Get my syringe, put it in there. I'm gonna flush my tubing first with 30 mils of water. So unclamp it, flush with 30 mils before I get to the bottom. I'm gonna clamp it back. Next, I'm gonna get my feed. This is my feed. I'm gonna put my feed and my bolus feed in. Unclamp it. Before it gets all the way to the bottom of my feed, I'm gonna clamp it back. I'm gonna flush it with 30 more mils of water. Flush. Unclamp, let it go down. Clamp it back so air won't get into my patient. I have flushed it, 30 mils, put my feed in, and I flushed it again with 30 mils. Okay. That was my bolus feeding. So now I will be doing my medications. He's off of suctions for 30 minutes. And now we're gonna do our medication. Before I do my medication, I'm gonna check for X-ray. Check the placement with X-ray and gastric content by pulling it out with the syringe. So I'm gonna clamp my tubing before I open it. Get my syringe. Let gravity take place. I'm gonna get my water, flush it with 30 mils. Before it gets to the bottom, I'm gonna clamp it. Get my meds. Put that in there. Open it. Before it gets to the bottom, I'm gonna flush it with 30 more mils. All right, before it gets to the bottom, I'm gonna clamp it again. So I have flushed it. I flushed it before I gave the meds. Put my meds in, I flushed it after. My tail is closed so it won't get air into my patient. Now that was my feed, and that was my medication. All right, you have gotten your suctioning, you gotten your bolus feed, and you got your medicine. So now we're gonna remove the tube, okay? So what I'm gonna do is I'm gonna sit you up, and I'm gonna give you some tissue, and we're gonna offer oral care after this, okay? So I'm gonna sit you up, and I'm gonna remove the tube kind of fast, okay? Well, not fast, but kind of, swiftly. And what you're gonna do is hold your breath while I remove the tubing, okay? So I'm gonna undo this. And I'm gonna count down. You're gonna hold your breath, okay? 1, 2, 3. Okay, you did good. Throw this in the trash. Offer oral care. Let him blow his nose. I'm gonna put his bed down into the lowest position. Bed back down to the lowest position. I'm gonna put his collar light in reach. Side rails up ×2. Collar light in reach, side rails up ×2. Bed in lowest position. Hand hygiene. And that's it.